evacuative and suppression testing procedure. 80,400 to 80,439. Evacuative or suppression testing refer to a class of tests performed where one substance is measured both before and after the administration of another substance to determine if the level are stimulated, evocative, or suppressed. They are most commonly performed in the evaluation of possible endocrine disorder. So in this case, already a substance is given to the patient. Then again, it is measured before administration of another substance, as well as this is again measured after the administration. So to check whether this administration of the new substance has stimulated or suppressed the level. So these are most commonly done in the evaluation of possible endocrine disorder. So these are the stimulation panels or evaluation panel, calcitonin stimulation panel. So instead of writing 82,308 into 3, we write this as 80,410 if it is a calcitonin stimulation panel. And this combined rapid anterior pituitary evaluation panel include all these codes. So we can see an example. A patient arrived to the ED. It appears the patient has been suffering from periods of disorientation, persistent stomachache, fatigue over the past several months, but the persistent patch of dark skin that appeared on the patient's chest has prompted his visit. The treated ED physician orders a stimulation panel for adrenocorticotropic hormone consisting of 2 cortisol injections 60 minutes apart. Blood tests reveal the ACTH level are at 300 mol per liter and diagnose the patient with adrenal insufficiency. So what is the procedure done, lab service done here? So we can see what is done. Adrenocorticotropic stimulation panel. It is a stimulation panel for adrenocorticotropic hormone consisting 2 cortisol injection 60 minutes apart. So instead of writing 82,533 into 2, that is for the cortisol injection, there is a panel for adrenaline insufficiency. So the stimulation panel for adrenocortical hormone, that is for adrenal insufficiency, we have a panel called 80,400. So we should not report 82533 into 2, but 80,400. Now, Jane underwent a combined rapid anterior pituitary evaluation panel with multiple exposure and suppression and had a hepatic function panel. How should these tests be reported? So if we check A as well as C, we can see so many codes. So first thing we have to check whether there is any panels. So combined rapid anterior pituitary evaluation panel with multiple exposure and suppression. The panel code is 80,480. And one more panel is the hepatic function panel, that is 80,076. So no need to report all these A and C options, but our answer is B with 80,418 and 80,076. Now, pathology clinical consultation. Pathology clinical consultation service code 80,503, 504, 5 and 6 describe the physician pathology clinical consultation service provided at the request of another physician or other qualified healthcare professional at the same or another facility or institution. So here there is a request from another physician. or maybe another pathologist. So the first thing is a request. So here, a pathology clinical consultation is a service including a written report rendered by the pathologist in response to a request. For example, written request, electronic request, phone request, or face-to-face request from a physician or another qualified healthcare professional that is related to the clinical assessment for the evaluation of the pathology and lab finding or other relevant clinical or diagnostic information that require additional medical interpretive judgment. So, there is pathology clinical consultation means there is a written report rendered by the pathologist in response to a request from a physician. So there is a request from a physician, and in response to that, there is a written report rendered by the pathologist. So this procedure includes the pathology clinical consultation. So we can see there is a request, render, and report back. Now, urinalysis procedure. So these are different urinalysis procedures we can see in our text. So here also we can see the urine pregnancy test also. Then urinalysis, non-automated with microscopy, automated with microscopy, non-automated without microscopy, automated without microscopy. Then urinalysis, qualitative or semi-quantitative urine pregnancy test also. Now, an example. A patient had a semi-quantitative urinalysis for infectious agent detection. How should you report this test? So if we go through the codes in the options, 81050 is volume measurement, 1005 is urinalysis, qualitative or semi-quantitative, 1099 is unlisted. Our question is semi-quantitative urinalysis. So we can answer it as 81005, option B. What is the code and any required modifiers for dipstick urinalysis, non-automated, without microscopy, performed in a physician office for a Medicare patient? So the question is urinalysis, dipstick, non-automated without microscopy. So code is 81002. And the modifier 26 is not needed because this is performed in the physician office. A patient's mother and sister have been treated for breast cancer. She has blood drawn for cancer gene analysis with molecular pathology testing. She has previously received genetic counseling. Blood will be tested for full sequence analysis and common duplication or deletion variants, that is mutations in BRCA1, BRCA2, that is the breast cancer 1 and 2. What CPT code is reported for this molecular pathology procedure? So if we check in the text, we can see for BRCA1 and 2, the code is 81162. Now some chemistry procedure. So these are the codes we usually see in the panels. For example, calcitonin, chloride, bilirubin, etc. So here also we can see creatinine in blood, glucagon tolerance test, glucose quantitative. All these tests. Now, example. Kathy has had intermittent abdominal pain, occasional diarrhea, stool frequency, and bloating. Her symptoms have worsened over the past 2 months. Her physician orders a fecal cal protecting test to check for Crohn's disease. So, if they check the options, 82270 is a blood occult by peroxidase activity, and 271 is other sources, and 2272 is blood occult by peroxidase activity, feces. Qualitative 1 to 3 simultaneous determinator, and 83993 is cal protecting fecal. So if we go through our question, we can see the physician orders only a fecal cal protecting test, not blood occult test. So for fecal cal protecting test, our code is 83993. Now, A 35-year-old type 2 diabetic is feeling weak. The physician performs a stat glucose test in which a finger stick is done placing the drop of blood on the reagent strip. The test indicates the patient is hypoglycemic. The physician gives the patient some glucose supplements and perform another stat glucose test using the same lab test as before 30 minutes later. Second test show the glucose level returned to normal. So here we can see two tests. So first there is a glucose test on a blood on reagent strip. Again, after 30 minutes, the same lab is doing one more test. So if we are performing same laboratory test is repeated same day for subsequent result, how we can report? Modifier 91 is the correct modifier to use when the same laboratory test is repeated on same day for a subsequent result. So for the glucose quantitative reagent strip, okay, the code is 82948. So we did two tests on the same day. So we have to report 82948 twice. But with the second code, we have to report the modifier 91. Now, hematology and coagulation procedure, that is a bleeding time. Then we studied blood count automated, differential WBC, RBC automated, leukocyte automated, etc. A patient with deep vein thrombosis require heparin to maintain therapeutic anticoagulation level. He has regular PTTs drawn to monitor his level of anticoagulation. What is the code? So for PTT, that is a partial thromboplastic diet, the code is 85730. So in relation with PTT, we can see two codes. One is in relation with plasma or whole blood. Other is substitution plasma fraction. So they have not mentioned any substitution. So we are considering 85730, that is the PTT plasma or whole blood. Now, immunology procedure. A patient with acquired immunodeficiency syndrome, that is AIDS, present for follow-up care. A total T cell amount is ordered to evaluate progression of the disease. What is the correct code for the study? So, T cell count, total count. There is only one code, that is 86359. Next is transfusion. Larry had a venipuncture during his annual physical examination. The blood sample was used for the following antibody test: West Nile IgM, Shigella, mumps, and total hepatitis B. So the first code is 36415, which is a collection of the venous blood by venipuncture. So usually this is already included in the test, antibody test. So we are not reporting it again. So what are the codes? For West Nile IgM, we can see it is 86788. Then 86771 is for Shigella. 86735 is for mumps. And 86704 is for hepatitis B core antibody. So our answer is C. No need to report the venipuncture. A patient will be undergoing a transplant and needs HLA tissue typing with DR or DQ multiple antigen and lymphocyte mixed culture. So for the HLA tissue typing, for DR or DQ single antigen, we have to report, no, for single antigen, it is 86816, but in our question, it is multiple antigens. So we have to report 86817. For lymphocyte mixed culture, it is 86821. What is a CPT coding for thawing 4 units of fresh frozen plasma? For fresh frozen plasma thawing, each unit is 86927. Here we are having 4 units. So we have to use the code 4 times. So it is 86927 into 4. Now, microbiology procedures. Now example. Report MRSA central line catheter. Clinical indication provide medical necessity when there are no other finding. Patient with fever not responsive to antibiotics. So method is single nucleic acid sequence. And the culture is methicillin resistant Staphylococcus aureus, that is MRSA isolated. So 87641 is Staphylococcus methicillin resistant amplified probe technique. For SA, that detect MRSA, that is a methicillin resistance, and identify the Staphylococcus aureus using a single nucleic acid sequence. So we can hear the method is single nucleic acid sequence. So if we are identifying the MRSA using single nucleic acid sequence, then we have to report 87641. Next, so here we can see the clinical indication is inpatient, day 32 in ICU with fever, hematuria, generalized edema, pneumonia. 1. Urine fungal culture, urine, special request none, culture, no fungal isolated in 30 days. Lower respiratory fungal with or direct exam, sputum. Special request none, stain for fungus, no fungi seen. Culture 1 colony, Candida albicans. Blood fungal culture, blood arm white. Special request aerobic bottle, culture, no fungus isolated in 4 weeks. Blood fungal culture, blood right, IG catheter, swan. Special request aerobic bottle, culture, no fungus isolated in 4 weeks. So, if we check here, we can see 4 culture. First is urine fungal culture. Second is sputum culture, lower respiratory fungal with direct examination, sputum. So sputum culture. Third is blood fungal culture, and fourth is blood fungal culture. Again, but different site. So here we have 4 cultures. So for the first culture, that is a urine culture, fungal culture, the code is culture. If we check 87101, it is culture fungi, mold or yeast, isolation with presumptive identification of isolate, skin, hair or nail. If it is from this culture, is from skin, hair or nail, we can use 87101. But here it is urine. So if we check 87102 is other source except blood. Blood we are having another code 87103. So if it is urine, we can take it as 87102. Again, this is a fungal culture, but not skin, hair, or nail or blood. That is sputum. So again, we are using 87102 with modifier 59. And next, blood fungal culture. So for the blood fungal culture, blood arm right, we are taking 87103. Again, fourth is a blood fungal culture. Even though the location is again different, we are taking it as a blood fungal culture 87103 with modifier 59. So why we are using this modifier 59 with this codes? Because it is written in our text for multiple specimen or site use modifier 59. Okay, so we are using multiple specimen. That is 4 specimen, 2 specimen we are collecting or 2 culture from using the same code 87102. And if then 3 and 4 is from blood. So again we are using 59 with the second code. For repeat laboratory test performed on the same day, use modifier 91. So we already see that example. When we are using, for example, in the glucose, using the reagent strip, after half an hour, again we are repeating, that is the laboratory test, same test on same day, then we are using modifier 91 with the second one. Okay, but here this is multiple specimen or site, multiple specimen. Then we should use modifier 59. Thank you for watching my video. Please share and subscribe. Thank you.